I'd like to start by learning about you. Who are you? What are you passionate about?
Okay, so first of all, I started at Bayer on July 1st last year, so it's pretty recent. Coming out, as a pharma person, one of those. Before Bayer, I was with Sanofi, and before Sanofi, I was with Novartis. Originally, I was not really supposed to be in pharma, okay? By training, I'm a veterinarian.
Really? Did not know that.
It's pretty interesting because, veterinary medicine is something that has a lot of super practical aspects, and we also understand how you operate in a very, I would say, constrained setting in terms of budget, in terms of tools and everything. It was a very interesting place to be. But after I dived into science and after my PhD, I entered a bit by chance the industry. And then people, when I came to Novartis, they put me in front of a computer and they told me, okay, those are Affymetrix data. They are coming from samples of a clinical trial. Do something with it. And then started also my very big interest and passion for really data and what the data can bring into the way we understand, I would say, the physiology, the pathology, and how we can actually do a much better job about understanding what a clinical description of a patient means. So started from there, we did a lot of things on trying to understand stratifying patients, trying to understand how you match mechanisms to disease and what it means in the real world for the people, for the patients, for the physicians. And trying to find new ways of running the industry, bringing in new technologies to make what we do in pharma better, more efficiently, faster, and in the end, providing a better service to the society has been really a driving force throughout what I'm doing. And naturally, of course, digital came in.
Right.
When you have been working...
And at which point from Novartis, Sanofi, Bayer, did you first start to see digital really coming in to pharma? Over the years, I mean.
Over the years. You cannot imagine how it feels when you were starting to see the possibility of getting into a data-driven digital world, not having enough computing power, not having enough data, not having access to all of those things. And so seeing that as a dream, and all of a sudden, you see that movement, you see the complete change in situation, in access, and then you see that it can become true.
Right.
And at one point, I would say like 4 or 5 years ago, when we started to work also at Sanofi with the discussing the collaboration with Verily, and you say, well, now it's the time. Now, everything that we were sometimes daring to dream about can become a reality. We just need to push it.
So when we first met, one of the things we talked about was Minitel. For those of you who don't know what Minitel is the French network, or the network in France that every home had. Was this 30 years ago? And it's just interesting to think about how, and the Minitel system, you could basically have e-commerce, you could book train tickets, you could book travel. Every home in France had this, and I used to use, this is probably in the early 90s or late 80s, a Minitel system here in the United States to do live chat with my pen pal in France. So this was before AOL, this is before there really was instant messenger here. So to think about this concept I like to call the health innovation paradox, where in some sense it seems that things are taking a long time. So we had Minitel and this network for decades,
Yeah.
right? But at the same time, things are also moving very rapidly. What's your view on how innovation is moving specifically in pharma and digital innovation? Is it moving too fast? Is it moving too slow? Is it both at the same time?
There is a famous quote that says, the future is already there, it's not just evenly distributed. So the straight answer, it's both. Sometimes it's going super fast. I mean, in this environment, things are going super fast. The problem be a bit more the adoption and the integration that is still super slow. And if I take an analogy, I would say, after the genome was sequenced, actually one Caucasian genome was sequenced, we were all super enthusiastic saying that we're going to solve everything. Then we realized that there may be some intermediate steps, and then we'll say, okay, but at least we can use genetic, and we can use a lot of this omics that we're really developing quickly to do diagnostic. And then came in the whole problematic of how do you develop the diagnostic, the necessary investments in new diagnostics, and how do you get the diagnostic business to work with the pharma business? Mm-hmm. And many times it actually clashed. And even if you take, for example, Roche, which has integrated the diagnostic division and the pharma division, it's not obvious to get those two to work together from a business point of view. And I think it's one of the lessons we can have from the past, which is how do you also plan for your business model, and how do you plan the investments and return for both parties collaborating ahead of time in a given healthcare context? Because this is, I think, the key of going fast and going well versus getting stuck, as many companies working at the time in molecular diagnostic did.
How do you think we break those silos down? How do we get more collaboration, both within industry but also more broadly? I mean, how can we break these silos down in your view?
It's, we all want to break silos, but we all spend our time after reconstructing our comfort zone. It's a discipline. Breaking silos, it's really about a permanent discipline. And also trying to see that what we are doing, it's not just a business about developing a certain product and selling a certain product. It has to be in the context. So it's a willingness to collaborate, a willingness to speak the other language and try to find, realign the communication and realign the goals. Because in the end, those collaborations are really meant to solve pain points, bottlenecks. And it's refocusing on the task at hand that we can really force and break those silos. Because, it's human nature. You like to rebuild your comfort zone, so you have to revisit and be vigilant all the time. Us as an industry, and when also we collaborate with other companies.
Do you feel we're making progress? Do you feel we're in a unique moment? Are we moving faster? Are things getting better? What's your view on maybe where we are today as we enter this new decade, 2020?
I'm super optimistic that things are going to get better. I'm super optimistic that we are actually indeed at a unique moment in time. Why that? Because of all the innovation around, all these possibilities are unlocked by the digital world and everything that happened in terms of the progress on the data, the progress on the computing power, the accessibility of complex data architecture for a broader number of people. All the technical and I would say data analytics are there behind to help. And at the same time, we are all in a situation where we need to change, where we as an industry in healthcare globally need to change because we are facing a very big challenge. And it's not just an industry or a certain sectorial challenge. It's a societal challenge. We are facing a case where, we all know the population is aging. We are more and more human beings on the planet. We are more and more human beings wanting to have access to care. And if you calculate what it means in terms of demand, there is a tremendous growth. At the same time, we also know that in terms of resources and available for people to get access to care, there is a limit. Just put it very blunt, the lag time to produce an MD is 10 years. So are you going to wait for 10 years to get access to care? Probably not. You need to find a way to make sure that we use, in the best possible way, the people available to provide care to patients and people around. We also need to make sure that we use all this money which is put into healthcare in a much better way. We have to face a unique, and we say, efficiency crisis. And we are at the point where the pain is high enough to overcome any inertia around.
Right. Yeah.
And that's a very, very strong, I would say, a reason to hope that it's only forward.
Well, one of the things I appreciate about you is your global perspective, and you mentioned this in the context of global. What is your global view of where innovation is going, digital innovation? You travel all over the world. You're doing stuff all over the world. Maybe share some insight to the global opportunity here.
So it's very interesting because, and especially I really encourage to think about the digital solutions in a local context, because healthcare context is highly dependent on where you live. So you can use the high contrast between Philadelphia and Belize, but even if you are compare the US system with the European system, they are extremely different. And as a consequence, the pain points, the inefficiencies, some of them are common and some of them are really different. The patient and the person experience managing his or her health in those contexts is going to be different. Just let me take an example. In Europe, a lot of the European countries, like mine, will care for people from birth to death, and they don't change. And they are followed through, I would say, the same system for their entire life. I mean, it means that for people who want to look into data in a longitudinal way, by the way, Europe can be a source of inspiration to feed some, content and insights. It means also that your partner in finding inefficiencies and resolving inefficiencies is going to be different. It's not going to be mostly private payers. It's going to be more institutional, with the good, the bad, and the ugly coming with that, but also giving you potentially a longer perspective. Now, if you go to other countries, like China, we all speak about China as a gigantic opportunity for industry, the land of digital, everything being digitalized. But in healthcare, we also need to realize that China has a certain diversity and certain difference between tier 1 and tier 2 cities, the most advanced, and a very vast amount of the population who is facing a totally different context of healthcare in terms of access, in terms of treatments being offered, in terms of ability to get the latest innovation or an appropriate diagnostic. And those are different pain points. So you need to really understand what is the need and what you're trying to tackle in the local context. And finally, if you look at more developing countries where access is super limited, where there is no state system, where there are not even, I would say, decent HMOs, you can find other solutions where digital is going to help. is going to help to optimize the access of patients, is going to remove the constraints of distance, is going potentially also to alleviate some of the risk of populations moving back and forth between where they live and where they can get access to care. So each and every time it's putting a different light on different pain points that a care system needs to address. And that's where, when you think about all the healthcare digital endeavors, you can bring value slightly differently, but really help and make a difference.
So there's an ecosystem here of entrepreneurs, of innovators. You do a lot of partnerships with emerging companies. You've done some big ones recently. How should startups be thinking about working with Bayer? How do you collaborate? What's the right entry point in?
Okay, so two things. Bayer is a global company. It's not just a German-based pharma. It's actually really a global company. And we are extremely present, in Europe, but also in US, and very strong also in China. So we have a very big breadth of interest. And there are different ways of collaborating with us. They can be related also very simply to our products, when we are finding ways to help both physicians or patients or people to better use our products or to get some support. And we are always looking for creative solutions to deliver not only a product, but a much better user experience in the end. So that's one thing when you can interact with us directly through our G4A program, for example, because we had a lot of calls to action. Now,
you've done a lot with G4A, and we're one of the early pharma companies kind of really going all in on starting very early with startups. Is that going to continue on? Is that the Grants for Apps program?
Absolutely. I have no credit to claim on that because the people before my time actually did all the work, and I'm finding a great team really in place and having a very interesting program and developing and maturing. G4A is a startup in itself somehow because the model is evolving with time, is evolving, and we are learning. We are co-learning actually with the startup. So G4A is definitely an entry point, not only to support the inline pipeline, but also, I would say it's going to be going forward on a very big focus for us to feed our, the development of an ecosystem in our digital project and our digital strategy. We really want to continue that G4A experience, but also growing ourselves into something that can lead, I would say, more and more companies into more execution and growth mode. And it's the recent evolution that will continue progressively with G4A. Now, there are also other programs which are coming up with our LEAPS investments, where we put investments in different companies early on. It's not only for digital, actually it applies to other kind of innovations, but it's putting an early investment in something that is highly innovative and can really help us capture the wave of innovation early. And the case, we put an investment in OneDrop. We also have stakes in Metapad. And there are a lot of, even on the molecule side, some early technologies where we are investing through the LEAPS founding. And of course, for more mature or more advanced companies, we have an extremely active business development. So to sum up, there is the G4A, which is more the maturation aspects, catalyzing innovation around what we are trying to build. There is the LEAPS, really, for more institutional investments and taking equity. And there is the business development and licensing activities that are really now ramping up into the digital area.
Well, I hope you keep leaning into supporting these emerging companies, health transformers everywhere, they can really do so much when they can collaborate with global partners. So thanks for doing that. I thought we'd end with a quote that I read on your Twitter that you retweeted recently in November. The quote is, "Dreams don't like to linger in dreamland for too long. Invite your dreams to the real world. Let them escape." And I love that. So what dreams would you like to invite to the real world?
I would say the essential dream is that there is a converging effort to make sure that we shift totally from, I would say, a systems that is scattered and siloed in something very much more united that really helps people dealing with health. And healthcare is a business. The healthcare is something with a purpose, which is, way beyond the business. So invite your dreams and get them meet the reality. And, your goal is to get your first smile on the face of a patient. And this is the dream I'd like to accomplish.
Well, thank you. Thank you so much, Jeanne.
Thank you.
Thank you. Thank you.